He was doing something around this thing.
This one?
Yeah.
When the ladder slipped, the saw ripped through his abdomen.
OK. He's a bit agitated, isn't he?
Until he can actually see the wound, Tom doesn't know if Daniel has cut an artery or is in danger of losing any fingers. At the very least, he has concussion, but the memory loss and blackout could be the sign of a much more serious brain injury.
I think I broke my brain! Ow! Ow! Ow!
13 minutes after they were called, Will and Colin arrive on scene to be briefed by the ambulance crew.
All right, thanks. My name's Will.
Has been working on a building site, ground floor, just across the road from here. He's been using a plunge saw. Thought he had it all stable and reached underneath it, but it's still been going. It's dropped and gone through his arm.
Okay.
We've just got quite a deep laceration to the right forearm there.
Righto.
The blade has sliced open a deep 3-inch wide wound.
Have a clean bandage as well. Clean cut. Went quite grey. Was quite shocked from everything that happened originally. Had his legs raised on our arrival.
Rich was working alone when the mechanical saw caught in his coat and sliced through his arm. He ran outside to get help before collapsing unconscious in the street.
Got my first set of rods done now. Just got him inside, so so cold really.
Lovely,
so,
lovely.
Quite deep.
I think we have gone through some tendons or ligaments there, haven't we? But not much in the way of blood loss.
We're unsure. The towel that was wrapped round him disappeared once we were getting there. There was some blood in his left glove, so we're not sure exactly. There's no blood loss through the floor either.
Oh, well done.
If the blade has cut through muscles and tendons, there's a chance Rich could lose the use of his arm.
Do you think there is tendon damage?
It looks like it.
Have you got a good sensation in all your fingers?
Yeah, I can feel them all.
Can you move them well?
Pins and needles.
Do you feel like your grip is weak?
Last year, there were 54,000 injuries on building sites.
Do you feel sick at all?
A little bit.
A little.
This is a 26-year-old chap who is working on a construction site with what he calls a plunge saw.
Will phones control to update them on Rich's condition and discuss which hospital he should be sent to.
This saw has come down onto his the inside of his right forearm, and he sustains an isolated open laceration. It's quite deep. There's a lot of stiff adipose tissue, and it looks like there's possible tendon and ligament damage there as well. As he was sort of moving, you could see stuff moving in the forearm, if you know what I mean. We'll go with QE as his destination.
Rich's arm urgently needs to be assessed by a plastic surgeon, which means he will be blue lighted to the Queen Elizabeth Hospital Major Trauma Centre in Birmingham.
There was no sort of foreign bodies, debris or anything. It wasn't dirty, was it? It did look clean, didn't it? Yeah.
Rich's blood pressure and heart rate are returning to normal, so the ambulance crew can give him some pain relief with less risk of him passing out.
What we might do then is pop a little cannula in your arm, give you some paracetamol that way.
How much pain are you in?
Well, it's getting worse as it's go. Look, I'm calming down a bit.
Yeah. If you had to give the pain you're in a score, a mark out of 10, 10 being the worst pain.
I'd say maybe about a 6 or 7.
Oh.
22 minutes after they arrived on scene, Rich is ready to start the 5-mile journey to hospital.
Get that arm sorted, right?
Yes, guys, thank you for your help.
Well, there you go.
Take care. Get well soon.
Satisfied with his progress, Will and Colin are happy to leave him in the care of the ambulance crew. A man is lying crushed beneath 1/4 ton of cast iron. The range of potential injuries are so severe, the critical care team have been scrambled. Helimed is above the house within minutes. Matt and Karen are concerned the longer the man is trapped under the machinery, the more damage is being done.
If they've managed to get it off quite quickly, then we'll be looking at some soft tissue damage and fractures. If it's stayed on his legs, how long it's crushed his legs for, because then you get problems with circulation.
Hello.
How are we doing? You all right?
Says you can feel it. Obviously, it hurts.
Yeah.
Arriving on scene, Matt and Karen are quickly briefed by the fire service and a local ambulance crew before they can take control of the rescue.
He has got a collis fracture on his left wrist as well.
Okay.
So we're just in the process of getting the engine off.
Okay. What's your name, fella?
Dave.
Dave. My name's Matt, one of the doctors off their ambulance. All right.
scrapyard manager and Land Rover enthusiast Dave Evans was renovating one of his old vehicles when the heaviest part, the engine block, fell off the workbench.
Can we get you back on this gas and air?
Dave tried to stop the fall, but the huge weight was too much, breaking the bones in his wrist.
And it's just toppled over onto him from there, has it? Presumably.
The ambulance crew have splinted Dave's broken wrist and given him gas and air and intravenous morphine to help him deal with the pain.
How's he doing with the morphine?
Although Dave appears calm, Karen is worried about the potential injuries to his leg that they can't see.
Is it from the lower leg?
What I can only see just around the knee, I can't see below.
Has he got a distal sensation?
Karen is worried the engine could be restricting the blood supply down his leg. This could lead to Dave losing his foot. It's essential they get the weight off before it's too late. Every second counts, because without proper circulation, there's a real risk that the leg won't recover and it will have to be amputated.
The leg can just go ischemic. You cut off the oxygen supply and then that builds up toxins. And then, of course, when it's released, those toxins can then go into the main circulation.
The fire brigade are trying to free Dave using hydraulic lifting equipment, but without a clear view of his trapped leg, it's hard to get the machinery into the correct position without risking even more traumatic injuries.
Right, that's it. Really slow, deep breaths now.
He's had 15 milligrams of morphine and continues to take gas and air to deal with the intense pain.
Right, let me hold it. Good man, that's it. And again. Deep breaths.
With the lift now in position, the firefighters and medics work together.
Good. Deep breaths, Chris. We're supposed to do this, mate. Go on.
Right, sorry.
Deep breaths, I say, well done.
Oh. Hold on.
Just hold it there.
You're going to help yourself, though, would you, right? Yeah, go on, forward. Okay. Go on, forward. We should stop. Go on,
Smash it.
go on. Go on.
Well done.
There we go.
With Dave's leg finally free, Matt and Karen can assess how badly it's been damaged.
Good man, let's have a little look at it.
How's your pain now that you've come out?
Just because my foot's been crushed, but I don't feel like it's broke. My wrist is definitely broke.
Yeah. Are you tolerating the pain at the moment?
Yeah.
That's a lot better.
My leg feels fine.
Good.
Very good.
Your toes a bit blue.
Give your toes a wiggle. Good man, well done.
Miraculously, despite being trapped under a quarter of a ton of cast iron, Dave appears to have escaped with just some painful bruising.
Shall we get your chair, do you think? Yeah. We'll pop him in a chair and go over the back.
She gets to shout at you now you're all right.
You'll just have to do it in the house next time, won't you, where it's dry? Be all right. He's been very lucky. It's just sort of pinned his leg to the floor. He's got no serious injuries. People can come off much worse if he'd fallen on his femur, his pelvis, his abdomen, his chest. You know, his injuries could have been far more significant.
Dave is being taken to hospital by the ambulance crew, leaving Matt and Karen clear to respond to the next emergency.
It looks like a 43-year-old male who sustained an abdominal injury from a chainsaw and his intestines are out on the floor.
An ambulance is already on scene, but the man's injuries are so severe that they've requested critical care backup. Tom has been dispatched.
It's easy to paint a picture, but you really don't know until you get there.
11 minutes after receiving the call, Tom arrives at the address. His body cam records every detail of the horrific scene.
Hi, right. Hello, sir. My name's Tom from the air ambulance. What's your name?
The injured man, 43-year-old forklift driver Rafa, is being given oxygen by the ambulance crew to try and keep him conscious as his body reacts to the shock of the 5-inch wound to his lower abdomen.
Right, so with this, if you just want to cover that with that. Perfect.
I'm just taking a photo of it.
No, that's fine.
Just in case you want.
Right then.
It looks like it's adipose tissue more
Yeah.
than anything, doesn't it?
The blade has sliced down through skin and flesh, exposing his intestines.
Oh.
Tom needs to try and keep the wound clean, prevent his intestines coming out, and stop the bleeding.
Hopefully, if we can just hold it around, it will stick to it a little bit. and then if I can get you guys to put some tape around that, is that all right?
Just going to stick the dressing down, Raphael, okay, just to keep it clean.
Okay, so this gentleman, age I believe you already know, he's a GCS of 15 at the moment with isolated abdominal injury with partly eviscerated bowel.
With such a deep wound, Tom knows Rafa could have catastrophic internal bleeding. He needs to get him to hospital fast for emergency surgery.
I think my initial plan would be to get some IV access, wound management, and then convey him to the QE.
The danger is that moving him may put too much strain on him and send him into cardiac arrest.
How are you feeling? Sam, can you get some IV access? Is that right?
Operation, yeah?
Yes, he will need to. Right, we're going to cut this off.
It isn't safe to move Rafa until Tom knows the full extent of his injuries.
You ready just to put him forward? I just want to check his back while we're here.
Yeah.
It's very sweaty, isn't it? OK, so no other injuries. Was this done on a chainsaw?
Yes.
Can you find out exactly what's happened?
The gentleman there speaks English.
How are you feeling?
He went on a ladder. He was doing something around this thing.
Yeah.
And yeah.
It turns out Rafa was fixing the guttering with an electric saw.
This one?
Yeah.
When the ladder slipped, the saw ripped through his abdomen.
Yeah, 6'2", just an update. So heart rate's around 50 at the moment.
Rafa's blood pressure is low, which could be a sign that the blade has damaged some large blood vessels internally or even perforated the bowel.
He's quite clammy and sweaty at the moment. I see no immediate signs of him hemorrhaging, however, I don't know how deep it is.
They have to get him to hospital.
I'm going to get him in the back of the ambulance and convey QE. I'll put some details as we go. OK then, Rafa, we're going to put our chair here. We're going to get you to move you and take you into the back of the ambulance, OK? My only concern is he's a bit hypotensive, so he might go a bit funny if we stand up. So we're trying, obviously, avoid as little movement as possible. Hold on to my hand. OK. Do you feel like you can walk? No. OK, that's great. Are you sure? OK.
Despite Rafa's horrific injuries, Tom has no choice but to move him onto the ambulance.
Yeah.
Keeping the pressure on the wound to stop his intestines spilling out.
I'm just a bit worried he's a bit hypotensive, so we'll just take our time. Well done. OK. Up you come. So, at the moment, this gentleman's got a circular saw accident to his stomach, part of his bowel, and a lot of his stomach is out at the moment, so we've dressed it. We're going to give him some drugs to stop him bleeding and pain relief and take him to the major trauma hospital in Birmingham.
Just going to give you some pain relief, some paracetamol, OK, to help with your pain, Rafa.
How are you feeling? Yeah?
They head to the major trauma centre at the Queen Elizabeth Hospital, where Rafa will need immediate surgery to repair the wound and stop any internal bleeding.
Rafa, are you all right holding that?
On the journey, Tom needs to keep his patient under close observation. There's a real danger his low blood pressure could suddenly drop, putting him into cardiac arrest.
Rafa, how are you feeling? All right? Good. Well done. You're doing a great job. We're nearly there.
Arriving at hospital 23 minutes later, Tom can hand over his critically injured but now stable patient to the waiting specialists.
Thank you.
6-2 at scene.
Once on scene, Pete is briefed by the ambulance crew.
Hi guys.
Hi.
How are we doing?
Helmet came off in the crash.
Has you been speaking to us?
Not at all. We've been like since we got it.
Okay.
21-year-old Curtis has been thrown from his motorbike after colliding with a car. In the impact, his helmet came off before his head hit the road.
Okay. He's a bit agitated, isn't he?
Curtis has a severe head wound.
It's quite common when we get this sort of patient. Big head injuries start getting agitated. It's not intentional, he doesn't know what he's doing. He's got a really reduced level of consciousness. Has he got a radial pulse? Yeah. Okay, let's see if he'll tolerate an oxygen mask, all right? Let's pull his stuff out. Yeah. That's it. We'll see if we can get him onto the scoop as best we can. His GCS, his eyes are open.
To try and evaluate him, Pete uses the GCS, or Glasgow Coma Scale.
Mate, can you hear us?
Usual hazard
Okay. A scoring system that helps describe the level of consciousness. A normal score for speech is 5.
Verbally, he's probably a 2, isn't he?
Further indication that Curtis may have a traumatic brain injury.
We want to protect his brain, and by taking over his ventilation and us doing it instead of him, we can protect his brain and stop it swelling, hopefully. That means putting him into an induced coma.
Breathing automatically with a ventilator will allow Curtis's brain time to rest, calming the swelling. But an induced coma is a risky procedure, usually only carried out in hospital.
Are we treating it as life-threatening this time?
I would say it's got the potential for that, yeah. Let's just try and keep him as still as we can, all right?
The impact dislodged his helmet, and he now has a suspected brain injury.
Pop his legs onto there. We'll get him on the stretcher. I think he's a bit hypertensive because I can't feel a radial pulse.
Curtis's condition is so serious that he needs a trauma doctor to put him into a coma to protect his brain. But the air ambulance carrying one is still 8 minutes away.
I think the priority, right, if we can get him on the back of the vehicle and we can do a proper assessment on him, we'll get some access.
Curtis is losing blood from his head, but his weak pulse indicates internal bleeding too.
We'll get full monitoring on him. We'll see what his BP is. I suspect his BP might be low, so it may be that he needs some TXA, all right. But if we could get some head blocks on just to keep his head still, all right.
So you've got IV access, that's
Nice one, all right. Is that the TXA, is it? Yeah.
Pete needs to give Curtis tranexamic acid, or TXA, which helps prevent excessive blood loss.
Let's get full monitoring on him if we can, and let's see what his observations are. Let's cut his trousers off and get that skin to skin. All right.
The doctor on board the air ambulance is now just moments away, but Curtis is deteriorating by the second.
Is he breathing?
Yeah.
His respiratory is very shallow. It's obviously quite pearly. Let's get an airway in him if we can. What we might need is a BVM as well once we've got that. So let's get that eye gel in first.
29 minutes after the 999 call, the Midlands Air Ambulance arrives with critical care paramedic Ryan James and trauma doctor Ben Taylor.
He's collided with that car, or the car's collided with him. It's thrown him off, his helmet's come off in the impact. He's got a big head injury. He's been spontaneously breathing, although he's very shallow. I'm setting up for RSI.
I'll leave you set up, carry
on. Yeah.
I'll assist.
All right, yes, please, yeah. Is that all right?
Sort of drugs out.
Yeah. He's had some TXA due to mechanism. Yeah, I've drawn some ketamine off. There's 160 left there, Ben, because he's had 40 out my 200.
The critical care team use a range of powerful anaesthetics, like ketamine, not carried by ambulance crews. They can also perform procedures normally only done in hospital.
Going to give an anaesthetic just to protect his brain and give him the best possible chance of recovering from his injuries.
Putting Curtis into an induced coma might give his brain precious time to recuperate and encourage any dangerous swelling inside his skull to subside.
So plan to the RSI in the next 5 minutes.
To place Curtis into a coma, he first requires RSI, rapid sequence induction, an advanced critical care respiration procedure that Pete decides is safest to do outside the ambulance.
Because the process is quite risky, we need to have 360-degree access. So if the patient starts to deteriorate for any reason or we're having difficulty with the airway, we've got good access and we're not sort of fighting over each other.
Dr. Ben then prepares to put Curtis into a coma with 2 injections, a sedative and a paralysing agent.
BVM.
Yeah, on.
Entitled.
Entitled's on, reading at 3.0.
BP systolic.
The last systolic was 127.
And cycle set.
Cycle set every 3 minutes automatic.
Saturations. Is that okay? Drugs going in now. Okay, fentanyl's in. Ketamine is in.
Okay, everybody ready? Okay, so oxygen mask is coming off. Okay, there's no loose teeth that we've seen. So I've got the blade, and I'm going to open his mouth as wide as I can.
We're going to go for the video scope first. Video scope first, with a size 4 blade. Okay, we've got a backup of a Mach 4. Yeah. Batteries check charging. Okay.
A laryngoscope, a camera with a screen, allows Pete to look into Curtis's airway for obstructions.
I'm going down the right-hand side of his mouth, sweeping the tongue to the left, and I'm going to walk down as I go and looking for landmarks. I've got the epiglottis, but... OK, a bit of suction, please.
Suction.
There's quite a lot of phlegm at the back of his throat.
Okay. What should we like?
OK. I've got a grade 1 view there. I can see the cords.
With a clear path, the breathing tube can be inserted into the trachea.
OK, I think through the cords and the black line, we are 22 at the teeth, Ben. OK, we've got misting of the tube. OK, I'm coming out with the blade. Cheers, thanks.
Curtis is now in an induced coma and breathing with the aid of a ventilator. Dr. Ben and the ambulance crew have done all they can.
Just nice and steady, buddy.
The importance of our services, we're bringing some of the emergency department to the patient rather than the patient having to wait to get to the emergency department. He's been anaesthetised a lot faster by us getting a doctor quickly to scene, so we've saved him some time and hopefully improved his outcome that way.
Hello? I've had a car crash, please, someone else.
Okay, are you injured?
Yeah, really bad,
Okay, all right, listen, what's the address? Where are you?
I don't know.
Ask somebody to help you.
I can't, I'm in the middle of the road.
Okay, are you out of the car?
Yeah, the car's in the tree.
The car's in the tree?
Yeah, but my friend's a trap.
How many people are in the car?
3.
We found you, my love, okay, stay on the side.
I think I broke my back. Ow! 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 Ow!
4 ambulances, multiple police units and 2 fire engines have been called to the site of the crash.
Mike Delta 98 on channel, leaving QE now.
Critical care backup is also urgently required, so Richard and Ian need to get there fast.
Got 1 male, 2 females, still trapped in the vehicle. One's possibly got an impalement injury on a tree tipper.
Mike Delta 98, that was all copied. Our ETA is approximately 3 to 4 minutes, over.
With multiple casualties, this is a major incident, requiring all the emergency services to work together to save lives. On arrival, they are briefed by West Midlands Ambulance Tactical Incident Commander Tim, who is coordinating the whole emergency effort.
So we've got 1 patient that's been ejected on this ambulance here. We've got 3 more in there. 1 has just been dragged out, a male patient. We've got some concerns over his airway. We've got 2 more patients in the back. They're lying on top of each other at the moment, so we're just trying to get a plan to get them out. Okay.
The 4 friends were returning from a restaurant when the car lost control before hitting trees and landing on its roof. 1 female passenger in her 20s was ejected from the vehicle and has just been moved onto the ambulance.
If one of you can have us a quick look, because they're pretty much packaged and they can get going.
Okay, right. Have a quick eye on this one? Yeah.
If you could also look at the chap that they dragged out that's potentially got airway.
Yeah. Okay, sure.
How you doing? You okay?
Hello. What have we got? Very quickly.
The patient on the ambulance is the woman who called 999. She is complaining of severe back pain. She is also bleeding from a head injury.
Jack, very quickly, patient 1 is the ejected female, is a GCS 14/15, good bilateral radials, moving all 4 limbs. We'll get the crew to ring you when they're ready to go with an atlas for Worcester, okay?
With her spine immobilised, Ian and Richard decide that she is stable enough to be taken to hospital.
Right, that's patient 1.
An ambulance crew prepare to take her, leaving the critical care team to assess the rest of the crash victims.
That one's going to Worcester.
You want to just have a look at the one that's been dragged out?
Yeah, if you don't mind.
Where are they? Just point us.
Is this person in the green shirt on the floor here?
Let's have a look over here, okay. What have we got?
The driver, a man in his 40s, is in a much more serious condition.
Is he speaking to you at all? Just about, yeah.
He was pulled from his seat by the ambulance crew and is now on a stretcher and only semi-conscious.
This chap dragged out. He was not able to be laid flat at all.
Okay.
Started to become back, rolled to his side. Quite a lot of blood coming back in his airway.
Okay, so I'll just get around that way. We'll just scoop him on his side, if that's where he'll be. Can you open your eyes, my friend?
Oh.
Where's your worst pain? In your chest. Are you happy on your side or lying on your back?
As Ian and Richard try to assess his injuries, screams are heard from the wreckage of the car, where the other 2 passengers are still trapped.
Can you lift this leg for me?
The driver is on the ground, semi-conscious. The full extent of his injuries is still unknown.
At the minute he's talking, he's able to speak. He said he's got pain in his chest and he wants to go onto his back. He's quite cold, but we'll just get him on his back and get him off. Have a look from there. There you go. Just roll onto your back, my friend. Go onto your back. There you go.
With the help of the fire brigade, the man is rolled over.
Guys, are you okay just to give hands and we'll lift him straight on the stretcher?
He's bleeding from a wound to his head.
On the You stay there, bro. We're going to get you on the ambulance, okay? Well done.
One female passenger in her 20s has already left the scene in an ambulance. The remaining 2 passengers are still trapped in the back of the car.
How you doing? Okay.
Given the high number of casualties, extra resources have arrived.
First casualty that was ejected, we've just had a quick once over the ambulance. She's obviously trauma tool negative, so we said Worcester for her.
Ian and Richard will focus on the driver, leaving the West Midlands care team to take over the trapped passengers when they are freed.
This chap, they've also got out. They were concerned about his airway, but he's talking. So doing another assessment now that he's on the trolley. And there's 2 people still in there that are trying to get out. So we've not had any eyes on them, but the heart team are in there trying to get them out.
The Hazardous Area Response Team are specialists trained to extricate and treat patients in dangerous situations. The fire brigade and ambulance crew are working against the clock to free the 2 remaining female passengers.
Scoot, please.
One woman is bleeding from her head. An hour and 8 minutes after the 999 call, the last 2 patients are brought out of the wreckage and are on their way to receiving emergency treatment. On board one of the ambulances, Ian has had the chance to examine the driver, and his condition is deteriorating. He needs to get to hospital fast.
If you get to the point we want to intervene further, we'll just give a shout, pull over, jump on in the back, and then we'll go from there. Is that all right? Okay.
Happy? Yeah. Yeah.
Ian and Richard will travel with him to provide continual care throughout the 20-minute journey.
So it's a male, we think in his late 40s. Injuries-wise, it looks like he's definitely got maxillofacial fractures and possible head injury as well. He's got a black eye on the right with a very swollen, deformed right cheek. His GCS was 13 and he's a bit agitated. So query head injury. He's been cannulated and he's had some ketamine sedation, a total of 40 milligrams so far.
Arriving at hospital, Ian and Richard deliver their critically ill patient to the waiting emergency doctors.
So it's quite a different job, that from what you're probably used to dealing with. So significant ITC with quite a few patients.
After a complex multi-service job, everyone can take stock and learn valuable lessons for the future.
It's very important, so particularly that job where there's lots of people there working and lots of things going on. It's quite useful to, at the end, go through what happened at the job, what we did, what could have been done better, and it's quite useful for the crews, for their learning, because most of the regular ambulance crews don't go to jobs like that very often at all. Probably once a year, if that.
Ambulance services, the patient breathing?
Yes, he's breathing. He fell off some scaffolding.
Okay, how old is the patient?
He's 74. He's gone very pale.
Okay. The emergency ambulance has been arranged.
Back injuries are among the most common major traumas and can be life-changing. It's estimated that every 4 hours someone in the UK is paralysed from damage to their spine. With a chance he could be seriously injured, critical care paramedics Stephen Mitch Mitchell and clinical team mentor Ben Reen are dispatched.
We are going to a 74-year-old who has fallen off some scaffolding boards, approximately 12 foot height, and apparently landed flat on his back. He's complaining of back pain and arm pain. So the risk is that he's got a spinal injury, really. His age brings something into that as well. Any pre-existing medical conditions like osteoporosis, brittle bones, they make a big difference.
Ben and Mitch are first on scene and find the man in his front garden.
Hi there. What's your name, sir? Paul. Paul. I'm Steve and this is Ben. How old are you, if you don't mind me asking?
74.
74.
Paul had been trying to repair some rotten wood on his house when the scaffold tower he was standing on gave way.
You look like you're in a bit of pain there.
Yeah. I've got a nasty gash on my finger.
Yeah. And where's the majority of pain?
Across my back and in the hip.
And with regards to the pain in your hip, is it on the same side as your back? Or is it the other side? Left hip, OK. We'll just go and have a quick look at your back and left, OK.
Whilst we're doing that, can you tell us what happened?
Yeah. I was on the platform up there.
Stood up?
Yeah. Stabilisers it all out. And for some unknown reason, it just started to go that way.
Yeah.
Twisted around, and I fell onto that bar on the dock.
Were you knocked out at all?
No, luckily.
Good.
Yeah.
Save that.
Bloody hell. No.
All right, pop your blood pressure cuff on there.
Where possible, the advice after a fall like Paul's is to stay still, because moving can cause injuries to worsen.
The reason I got up was because they were worried these plants might fall off on me.
OK, gotcha.
Fearful of the scaffold boards falling, Paul's wife and some nearby workmen moved him to safety.
When they assisted you up, did you move anything by his own means, or...?
Not a lot, no.
No, OK.
Mitch and Ben decide to leave him sitting.
You're fine as you are. We'll work around you.
OK.
All right.
Are you short of breath at all?
No, it's painful to breathe in.
Just painful, OK. You might have done something with your ribs at the back. Can you try and push down on your leg as if you're going to get up, but I don't want you to get up like that, OK. Right, we'll get you a little bit of oxygen and I'll just go and get some painkillers out of the car, OK?
Thank you.
All right.
The pain in Paul's chest points to a fractured rib.
Pop this on.
Is he normally quite a pale complexion?
Yeah, he's pale, but he's got
Yeah.
his paler than normal.
Mitch calls the control room to request an ambulance.
Could do with an ambulance. Patient's got shortness of breath from pain along ribs.
A spinal injury also can't be ruled out.
Would you like that as a red or an amber backup, over?
I'd probably put it as a red. What were you trying to do then?
All the wood's rotten. I was going to replace that.
Yeah.
And then paint the house.
Paul is in a lot of pain. He needs a scan to determine whether he has broken any ribs and to make sure he hasn't damaged his spine.
Did you want to do cannula and stuff like that? Yeah, it's sound.
While they wait for an ambulance, Ben and Mitch are doing everything they can to make him more comfortable.
This arm's not sore, is it?
No,
All right.
Only below the elbow.
I'm going to pop a needle in one of these veins and we'll get some pain relief in, all right?
OK.
All right, little scratch coming up, OK?
Yeah.
Ben inserts a cannula into Paul's arm so that painkillers can be administered straight into the blood.
Are you allergic to anything at all?
No.
Have you had any paracetamol at all?
No.
OK. It's paracetamol.
Lovely. Thank you.
Got that going.
Although it's just paracetamol, it works really well, actually, through the vein.
Yeah.
It should be a bit quicker for you.
Out of 10, how bad would you say the pain is? 10 being really bad.
Oh no.
Pardon?
A red 7.
Although Paul's putting a brave face on it, he's still in agony.
Have you had morphine before?
No.
No.
Morphine sulfate, 10 milligrams 1 mil, 223.
Is that easing off a little bit there?
Yeah. No, it's only when I pass it up I'll get the time.
Okay.
Finally, the pain is beginning to subside.
We're just waiting on the ambulance now, all right.
Yeah.
Paul will be taken to the nearest hospital, where he'll be x-rayed to find out exactly what damage he's done.
Hiya. I don't think he's going to be able to move too far, so I think if we bring the stretcher like right up next to him, start there a sec. I think come back a bit. That's it. Yeah, perfect.
As they are confident his injury doesn't involve the spinal cord, Ben and Mitch help Paul to get himself onto the stretcher.
Brilliant work. Well done, Paul. So your head goes that end.
Going up this way, yeah.
And then we'll bring your feet up.
Back if you've got the legs.
Okay. Keep your feet together. Keep your feet together. That's it.
Will he have to stay in?
We don't know. It's completely up to the doctors and what they see and what they find.
He was clearly in a lot of pain and he may have some rib fractures. Hopefully he hasn't done anything to his lung or anything like underneath.
Ambulance service, patient breathing.
He's come off his push bike, he's unconscious, he's breathing, all his teeth are gone and everything. He's in a bad way, his face is at the road.
And does he seem to be taking regular breaths?
He's breathing very fast.
Is the patient in the road?
He is in the road, yes.
How old do you think he is?
I'd say he's in his 60s. Not tall his teeth, certainly.
We've got an ambulance en route, okay, so just keep your eye out for the ambulance.
I will do, yeah.
A local ambulance has already been dispatched to the scene of the accident, but there's a high chance the man has suffered paralysis or brain damage, and his life may be at risk, so critical care backup is needed.
It's coming through with unconscious male in his 60s that's come off a motorbike.
60, that's what we see. Thanks very much. I think we'll be about 8 minutes of it.
Critical care paramedics Will Meadows and Colin Apps deal with life-threatening emergencies on a daily basis. Their advanced trauma training gives the most gravely ill the best chance of survival.
Yeah, the information's come through that he's unconscious. That would suggest that he may well have serious injuries, including injuries to his head.
10 minutes after receiving the emergency call, they are on scene. The local paramedics have taken the injured man into their ambulance.
Sorry guys, my name's Will, one of the critical care paramedics.
I'm Joe.
Paramedic Joe quickly briefs Will on the details of the accident so he can begin his assessment.
He's been travelling on his motorbike, no helmet. Push bike, sorry. Yeah, apparently the front wheel has locked up.
Yeah.
He's gone over the handlebars and full impact on the front of his face.
Okay.
73-year-old Fred, a retired crane driver, was riding back home after visiting his 99-year-old mother when the accident happened.
Bystanders state that he didn't move to start with, so we're querying a period of unconsciousness with him. On our arrival, he's sat up, he's talking, he's fully orientated, he knew where he was, but he couldn't recall the incident of what had happened.
Okay.
Fred's injuries are so extensive, he needs urgent hospital treatment and a brain scan.
We've got a good 2-inch laceration above his right eyebrow. Initially, they said that he wasn't moving.
At the very least, he has concussion, but the memory loss and blackout could be the sign of a much more serious brain injury.
Have we found the teeth, or are they...?
Yeah. We've got 3 of them there,
Okay,
yeah.
so there's 3 missing and you found them all?
Yeah,
okay.
the ones at the back look quite broken as well. There's nothing that I can see that's gone through the pallet at the top.
How are you breathing? Is it okay?
Yes.
Yeah?
Yeah.
Okay. Are you in much pain at all?
No, fine. Just a little bit of bruise there.
Yeah, try not to touch your face there, sir, okay? Because we don't want to contaminate that. But yeah, you've taken a bit of a beating, haven't you? I think the road's won this time.
Yeah.
Yeah. Okay.
Will is most worried about Fred's unseen injuries. His head took the full force of the impact. Head traumas are very unpredictable, and there is a risk he may have damaged blood vessels that could turn into a more serious bleed on the brain.
I don't know what happened, actually.
No, I don't think you're going to have the answers either, Fred. Accidents happen really quick, don't they?
Will calls into the trauma desk to alert them that Fred is likely to need reconstructive surgery on his face.
He's got split lips. He's had 3 teeth knocked out. They're all accounted for. And his tongue's been split as well, sort of in the middle, and quite aptly described as lizard tongue.
The Queen Elizabeth Major Trauma Centre in Birmingham has specialist maxillofacial surgeons who can assess and treat Fred's head wounds.
Do you want pain relief for you?
No.
No,
it's all right.
Fair enough.
Try not to keep damaging it.
Amazingly, Fred seems to be untroubled by his injuries. He wasn't wearing a helmet. If he had been, it may have deflected some of the force of the blow and given him more protection from serious long-term brain injury.
If you're getting blood into your mouth, just let it dribble into there. Try not to force the spit, just let it dribble out.
As it stands, he will need a brain scan to rule out any potentially fatal clots or bruising.
How fast do you normally cycle there, Fred?
Oh, no.
It's not got a battery in it, has it, your bike?
No. It's an ordinary racer.
A racer?
Yeah.
Yeah, on his own.
Yeah. 40 mile an hour then. Head down.
Trauma desk is going to give them a heads up, so you can be seen sooner rather than later. And if they can't manage Fred, then they'll get him transferred to the QE where you can go. All right.
We'll get out of your way.
I don't know what happened.
Take care. Have a nice day.
All right, Fred. You mind how you go, okay? Next time, wear a helmet.
Yeah, I don't know what happened.
All right, guys. Thanks very much. Cheers.
Ambulance services, the patient breathing?
Yeah, he's had his hand in a steel saw.
A steel saw?
Yeah, it's gone straight through. I don't want to describe it too much.
How far through his hand has the saw gone?
Dan, you need to move your hand, please, because I need to describe it to her. I need to put your hand over your face. Hold on. Oh, very, very, very bad.
We're getting someone to him as soon as we can. Just keep the pressure on the wound, directly on the wound.
An accident with a power tool can inflict life-altering injuries. An ambulance has been called, but they've requested specialist trauma backup, and critical care paramedic Tom Waters is now en route.
Looks like I'm going to be first on scene, and it's someone, they just said he's cut through his hand with an angle grinder. DIY gone wrong. The benefit that I think my team and myself can go to is we can hopefully make that assessment to really identify what hospital is best for that patient.
10 minutes later, Tom is on scene. The local ambulance crew are already there.
Hello? Hi, you're right. So what's happened?
He was cutting the door frame there and went straight through his hand.
30-year-old bricklayer Daniel was cutting the timber on a workbench using an angle grinder with a 4.5-inch circular blade when he lost control and it sliced through his right hand. His wife Stacey found him and has been trying to stop the bleeding.
Okay, and how bad is it before we have a look at it? Is it pretty bad? Okay.
He hasn't seen it.
Okay, what's your name, sir?
Daniel.
Daniel. Do you live here, do you? Is this right? Okay.
Yeah.
The paramedics have been on scene for 5 minutes. Daniel is in a severe state of shock and close to passing out. They've got him to raise his arm above his heart to try and stop the bleeding.
It's fine. Have you got your trauma pack with you tomorrow?
No, I can go grab them.
Yeah, I think maybe if you're saying it's quite bad, we'll get our bandages just in case. If you hurt yourself anywhere else?
No.
No, so it's just your hand?
Yeah.
Okay. Do you mind if I...
Yeah.
This impressive towel you got on here.
It's the second one.
Okay. Okay, so what we'll do, before we open it up, we'll get our bandages just in case.
Daniel's in excruciating pain and can't bear to look at the damage he's done.
So, all right. Are you all right to come round here and cut his sleeve off?
Yeah.
I've got some scissors on me, if you want, yeah. So quick look. Okay. I know, sorry buddy. We'll give you some pain relief, but what I want to do is have a real quick look at it first.
Until he can actually see the wound, Tom doesn't know if Daniel has cut an artery or is in danger of losing any fingers. Both require immediate surgery.
Okay, all right, bud. You feel me touching your hair? Okay.
Daniel has a 3-inch wound, 1.5 inches deep between his thumb and forefinger. Once the towel is removed, it starts bleeding freely again.
Wiggle that thumb for me.
Can't.
Okay, all right. What we're going to do, buddy, is we're going to clean it up. It's in the corner bit of your thumb. That make you obviously know where it is.
Lucky for Daniel, the blade stops short of the bone.
Straighten that arm out for me. I'm sorry. Well done. I just want to straighten this hand for me.
Daniel is fortunate. All his fingers are still there, and there's no obvious nerve damage. The wound will now be cleaned with saline solution and dressed to immobilize the fingers and help stop the bleeding.
It's just obviously in the crease of his thumb. He's got good circulation here. Yeah, and he can feel me touching his hands. Yeah. And it's, yeah, so I think it's just more soft tissue.
Yeah.
We're going to cover it.
Yep.
And then I think we'll...
If we just take a picture? So
yeah, that's fine.
One of the paramedics takes photographs of the wound to show to the hospital doctors in A&E so they can assess whether he needs immediate surgery.
Yeah, nice and still.
All right. Keep still for us, buddy. As soon as you've done this, we'll get you some pain relief.
Last year, almost 5,000 people were admitted to hospital following accidents with power tools.
I'm going to bandage that up. It's going to be a little bit painful for a little while.
I'm sorry, mate. When you're working next, don't say Monday.
Yeah. It won't be.
I think it probably feels and looks worse than what it is.
Yeah.
I think it needs to be cleaned, it needs to be x-rayed,
yeah,
and it needs to be stitched back together.
Cheers for that. I don't know how you lot could look at it, to be fair.
That's all right, mate. There you go. Just take your time, nice and slow. With no rush. Feel right? Let me just walk behind you.
With Daniel now recovered enough to walk out to the ambulance, Tom is happy to leave him in the care of the local crew for the journey to hospital.
He'll go to the local A&E where he'll get it cleaned. He most likely will have some form of antibiotics and an x-ray, and then it'll be decided onto there if he needs specialist care to treat that part of his hand. It's very much in the forefront of our minds that we want him to get the best care for his hand. So he's a young chap, he's a labourer, we obviously need to get him back to work as soon as possible. It could have been a lot worse. It's still going to be a really painful injury, but hopefully I'll have a really quick recovery.
Ambulance service, is the patient breathing?
Yeah, he's conscious. Been knocked off the motor scooter, he's lying in the road.
What's he been knocked off with?
A car, still got his helmet on.
Okay, don't remove the helmet. Any pain anywhere in particular?
In his leg and in his arm.
Help is all arranged for the gentleman. Somebody could kindly remain with the gentleman until help
Yeah, we'll
arrives.
stay with him now until it gets here, yeah.
Okay.
In a collision, motorbikers are in danger of a direct bodily impact. They're 50 times more likely to suffer a fatal injury than car drivers. Faye and Tom are dispatched.
Got a report for the 28-year-old male. He's come off his motorbike. He's got what they're assuming is a couple of fractures.
With Faye and Tom still a few minutes away, an ambulance is first to the scene of the accident.
Just an update for you on this one. They've given him lots of shots and so far 10 milligram of morphine. They said that he's still screaming out in pain.
That's all understood. Thank you, mate. What's his name again?
Jack.
Jack. Hey, mate. How are you? Mechanism-wise, just came off.
Came off the bike, he was doing 30 and hit with this one. Came straight off.
Right.
Everything. Had helmet, had jacket.
28-year-old Jack crashed into the side of a car which pulled out in front of him, throwing him off his bike. Despite being given Entonox, he's still in severe pain.
So chest, abdomen, pelvis-wise, you're happy? Okay. Mind if I just have a quick feel? Any pain around here? Okay.
Tom first assesses Jack for internal injuries.
No pain in your tummy, buddy? No pain in your tummy? Arm-wise, it look obviously fractured?
I would say it's about there, I think.
Okay.
He does have a suspected fracture in his forearm.
This is a quick look at your legs. Oh, right then, buddy.
So we are quite swollen.
Yeah.
I feel.
It's all right.
And his femur or thigh bone is also broken.
I'm just going to take your shoe off your right foot. Is that all right? Good, good, good. I just don't want to do stuff without your permission. When you have been like manipulated, so was it more significantly anatomically not in the right way?
We've swollen quite a lot. We're also had some considerable spasm as well.
In his femur, is it? Okay.
Yeah, in his thigh.
All right. Okay. Good. So you're happy no other obvious injuries in here?
The femur is the longest and strongest bone in the body, and fractures can lead to life-threatening complications, including blood clots.
Okay, you've had plenty of morphine.
Cylinder ventanox.
Okay.
And gram of IV paracetamol.
Okay. In regards to the pain, it's just too much, is it?
Yeah.
Have you tried to put the Kendrick on?
No.
Okay.
Tom and Faye urgently need to get Jack to hospital for surgery. But to prevent his condition from worsening, they must first realign the bone using a Kendrick traction device.
Jack, we're going to sort your leg out. Is that okay? I'm just putting something on your foot.
But it's a painful process.
Does it work well on Ensox?
It's been working quite well.
Good.
So Tom administers more pain relief.
So what I want you to do is just take some nice deep breaths on that gas in there. Big deep breaths for us, okay? If you happily just hold the femur where it's unstable, I'll do a little bit of traction.
When you're ready.
Yeah, he's aware of it, so
Come on,
let's
Jack,
get...
be brave, good man.
While the traction device stretches out the leg,
Well done, mate.
Tom manipulates the bones back into place.
It is going to be a little bit sore for just a second.
Good deep breath, mate. Doing well, buddy.
Jack's broken his femur or thigh bone, and the team need to manipulate it back into place.
Go on, take nice deep breaths of that good stuff, mate.
It's painful to do, but necessary to prevent blood loss and reduce the risk of complications.
So he's probably got a bit of spasm in his leg.
Yeah.
Well done. A bit more, Faye, if you can.
Jack's taking deep breaths of Ventanox or nitrous oxide to manage the pain.
That's it, one more.
That's nice, that's looking good actually, Faye.
Nice deep breath.
Pretty tight, isn't it? Yeah. Looks matching, doesn't it? He's got a bit of a bend in his leg.
Good man.
There we go. Well done. Okay.
Now that his thigh bone's realigned, Jack's condition should start to improve.
Is he a little less in discomfort? James, ask him.
Yeah. Is that a little bit better?
Jack, you're listening.
Instead, he stopped responding.
Open your eyes to us, buddy. I just want to have a quick chat with you. Hello.
Jack, come on. Jack, you all right?
Jack, you all right, mate?
Jack, you all right?
You're all right,
It's because he's taken a lot of Ventanox, so he's just coming around.
Try that again, he's already done a bottle.
The pain relief has left him momentarily dazed.
Jack, which foot am I touching? Your left or your right? Good, well done.
Okay, brilliant. How are you feeling?
Pardon?
My leg feels a lot.
Good, good. That's what it's meant to do.
It feel much better once we've done it.
You ready?
Yeah.
Okay, on three.
Right,
One,
I'm going to pick you up, Jack.
2, 3.
Jack now needs to have surgery as soon as possible.
Looks a bit pale, doesn't he?
Yeah.
Let's just get him in the back then.
Yeah.
See how we are.
You all right, mate?
See you soon, bud.
Yeah, man.
There we go. It's a little bump, buddy. Just nice and slow. So he seems in quite good spirits, doesn't he? He's definitely got a bit of a bow, but yeah, I think no compared to what it was.
Once at Birmingham's Queen Elizabeth Hospital, it'll also be confirmed whether he has any other internal injuries.
You can feel me touching your feet. Brilliant. And just finally, what am I doing just up here? Yeah, good, okay.
In the meantime, the critical care paramedics have done all they can to put him on the road to recovery.
Jack, take care, buddy. We're fairly confident he's got a fractured forearm and a broken fractured femur. He'll probably need an operation, which he'll get either tomorrow or tonight. And then I think he'll have quite a good recovery.
ambulance service. Is a patient breathing?
Yes, he is. What's happened is he's a tree surgeon. He's fallen from the tree.
Yeah.
And impaled himself on a steel spike that was below it.
Okay, is he conscious and awake?
Yes, he's conscious and awake, but the spike has gone through towards his kidney area. They've got him off it. They're trying to put some towels on to stem the bleeding.
Did he look extremely pale?
He does look extremely pale, yes.
Yeah, okay.
He's now going paler every minute.
Of course. So we do have an emergency ambulance arranged for him, okay?
As this is a potentially life-threatening accident, Tom and Ben are immediately dispatched.
So we are going to a report of a 60-year-old male who has fallen out of a tree and impaled himself on some sort of spike or some metal. We are looking at some quite significant potential injuries from both the fall and the impaling of the spike.
Patient seems very pale and more paler by the minute. They're using towels to stem the bleeding. Patient now off the bar that impaled him.
No worries, thanks, Colin. So we've also got 03, which is one of the helicopters coming as well, just in case he's really, really quite poorly. Tree surgeon. I'm going for the tree surgeon.
Do you reckon?
I think that's a sensible option, isn't it?
Tom and Ben's colleagues, the air ambulance critical care team, are already on scene.
Hello.
Dr. Ali Hussain gives Tom a quick update on the patient's condition.
Hey guys.
You're right.
Hey. So 3 holes. Hi, mate. 2 flanks. Okay. 1 midline. What's your name, sir?
Alan.
Alan.
64-year-old tree surgeon Alan was cutting back branches in a client's back garden when he lost his footing.
It feels difficult to take a breath in. It's okay.
Alan fell 12 feet onto metal railings, which embedded themselves in his lower back. The homeowner called 999.
Take a big breath in for us. Do you find us catching it?
Dr. Ali is worried that one of the spikes may have punctured a lung.
In terms of chest, air entry's good. Belly is tender.
Yeah, fine. It's a bit difficult to know how far they've gone in. It looks like it could have gone in a bit further. But at the minute, the breathing's okay and everything. So, but we don't know how far it's gone into your chest, okay? So we're going to get a drip in, okay? Just reduces the chance of any bleeding, okay? How is your pain at the minute? Roughly out of 10, would you say?
Yeah, I think probably if we could.
If 10's the worst possible pain you could have, and 1's very, very little. Out of 6. Okay.
We'll get some TXA in.
Yeah.
The team are concerned about the level of damage the 4-inch spikes may have caused Alan's internal organs.
Yeah, what actually happened?
I was in the middle and it just stepped over it and just landed on the spikes.
Ben fits a cannula so drugs can be given intravenously, while Tom updates the trauma desk.
So this male is probably in his late 50s, 60s. He's fallen and impaled himself on a metal spiked fence. From visual inspection, he's got 3 punch wounds, central back, lumbar region. So currently just getting some IV access, giving him some TXA and doing some clinical observations. Currently, the aircraft has landed probably about 200 metres away.
Alan is given a drug called tranexamic acid, or TXA. If he has internal bleeding, this will help the blood to clot.
You know when you're sort of like squeezing your bottle together? Can you do that for us?
Squeeze together, right?
Good lad, that's fine. And you feel everything down below where you sat on?
Dr. Ali checks if the spikes have damaged any nerves in the spinal cord, which could lead to paralysis.
You're sitting on a bicycle seat. You can feel everything there, in that area.
I can move everything.
Yeah, it's really kind of...
Yeah.
Now, you sure we can't give you some pain relief? No? Right, okay. They're pretty nasty things to fall on, aren't they?
They are.
We give this antibiotic, sometimes a bit stingy. Okay?
Yeah,
Is that the Paramedics?
Yeah.
Coimoxiclav is a penicillin antibiotic. This will fight any bacteria that was on the metal spikes and help stop infection.
The ambulance has just pulled up. We're going to bring their stretcher to the patio. Gentle walk, take a seat, and then we'll pop you over to the QE. Is that all right?
It's because of the nature of, well, first of all, if you look, then spikes have gone in quite a few inches. So we'll take you to a trauma centre, okay?
Tom, Ben and the air ambulance medics are happy that Alan travels to hospital by road.
Copy of the odds,
for you as well.
Swing your legs.
Tom will travel with Alan to the Queen Elizabeth Hospital to provide advanced critical care if required.
So, we've got, in regards to pain relief wise, we can give you a bit of morphine en route if you're happy, or would you like some pain relief? You sure? Okay. If that changes en route, then just let us know and we'll go from there. This is a dangerous job you guys do, isn't it? It's naturally gonna...
Very often anything.
No.
Very rare, but that was just... I just tumbled out of the tree.
Yeah. And if that fence was there, you'd have been fine.
Yeah, if I'd landed a few yards.
Absolutely. Yeah. You'd have just got up and carried on cutting. How did you get yourself off?
I had a tiptoe on my feet.
Really?
To lift myself off the place. Because I couldn't pull because they were...
No, because they were inside here.
Alan may be putting on a brave face, but his injuries are profound. Tom will be keeping a close eye on his condition in case he deteriorates.
I'm just going to take your blood pressure again, if that's all right. That's going to go a bit tight on your right arm, that blood pressure, just taking your blood pressure, OK. Right then.
Only a scan in hospital will confirm whether Alan has damaged his spine or any internal organs.
2 on the side don't look too bad. I think the main one's been in the middle of your back. Yeah. But the fact that you've walked and you've moved and you've got no pins and needles in your arms, on your legs or anything like that. No, does it feel okay? Good. So that's the only thing they need to be quite, we need to be quite careful about. But you're normally fit and well. You don't suffer with any medical problems or... Oh, you're looking too fair.
Arriving at the Queen Elizabeth Hospital, Alan is handed over to the waiting emergency team.